Okay, today I am here with somebody I'm very excited to talk with, and that's my very dear friend, Bette Freedson. Bette is a very respected psychotherapist, licensed clinical social worker, and author in the state of Maine. She's the author of Soul Mother's Wisdom, 7 Insights for the Single Mother. And her next book, which we're going to kind of touch on a little bit, is going to be being released sometime in the near future, called Other Realms, Other Ways, a clinical guide to the magic of psychotherapy. So, Bette, thanks for being with me today.
It's a pleasure, always.
Yeah. Well, I thought today we could talk about an area that I consider you kind of an expert in, and that's the realm of clinical intuition. We have briefly talked about in some of my trainings and courses and books about the need for clinicians to feel comfortable, sometimes, jumping out a little bit and improvising and trusting themselves. And for a lot of people, they have trouble doing that, even seasoned therapists. So if you don't mind, can you just tell me kind of, what's clinical intuition to you? How have you learned to kind of cultivate it, and certain things where you've been able to learn how to differentiate, listening to your head instead of listening to your gut, which is gut's what you're supposed to listen to.
Well, that's what we have been taught. And because we know that the mind body is the body mind, listening to the whole body is how I would frame this, including the somatic self and including that disembodied self that we sometimes refer to as the soul, or that someone like Irving Polster would think of as the essential self or the essence of self. So it's a wonderful question. There are a few trajectories that I'd like to follow. First, to say that intuition, the way I understand it, and from what I've read and talking to you and other people, is a combination of what we know, what we don't know, and what we don't know that we know.
Mm-hmm.
And what has helped me differentiate clinical intuition from intuition is the context. And part of what I'm talking about in the new book, Other Realms, Other Ways, is what we're calling it for its catchy title. The subtitle is the other title, is that the context is clinically in the session. And what has helped me factor out clinical intuition from everyday intuition is using it in a session or in the context of even doing a diagnostic formulation, or what our friend Scott Miller will call, the deliberate practice outside of the session. How would I think about that intuitively? And so true intuition draws on both what I know, which is our training, the clinical training counts, and then a sense of something that fits in somewhere into the picture. But let me talk first about in the session, if that's okay,
Yeah,
because
please.
then that's clinical intuition in situ, if you will. And what happens there, I'd like to draw on what I've learned from Jeff Zeig, who is the director of the Milton Erickson Foundation, for whom we've both participated in conferences. And Jeff talks about the therapist putting himself or herself in a state of readiness to respond.
Mm-hmm.
Ready to respond to whatever the client is bringing into the session, readiness to utilize the client's material. So if I'm in a state of readiness for this interview, I'm ready to speak to whatever question you give me. And I don't have prepared remarks. So intuitively would be the same as in a session. I draw on what I have read, what I have written, what I've gleaned from talking to smart people like you. And then what's my sense of how I want to frame this? So it's the same in a session. The client brings in the problem or the situation.
Mm-hmm.
And maybe what pops in my mind is to use something very tried and true and linear and evidence-based, like a CBT approach. Well, that doesn't mean it's not intuitive.
Mm-hmm.
So then, if you want to get into more of the creative, spontaneous part of the question, I might, as I have a lot of props, I'm looking around, I'm not in my office, I'm in my study.
Mm-hmm.
So I have a lot of props in my office. So I have a couple things. Well, here's a prop. So this is a magic wand. I have one of these in my session. The client might be talking about something and all of a sudden I get an intuitive thought, which is like a gut feeling or a gut sense. Why don't I pull out my magic wand? Now, if you were doing psychodynamic psychotherapy, you probably wouldn't pull out a magic wand, and there's nothing amiss with not pulling out a magic wand, but it's just another tool. And maybe I would say, let's imagine that that problem could move right out of the picture. What then would you be looking at instead? So that would come to me, I wouldn't plan it. I would plan to have the magic wand. So clinical intuition is basically what's happening in the session and how I'm using myself.
Mm-hmm.
That's a beginning explanation. Lots more in the book.
I want to ask you that one statement, how I'm using myself. Could you elaborate a little bit on that?
Yes. So I'm trained as a social worker. And in social work training, we talk about differential use of self. Mm-hmm. So put that here. And then I'm also trained in hypnotherapy, as you are. And in hypnosis, we talk about utilization. Mm-hmm. Differential use of self is utilization. So I'm utilizing everything in me, mm-hmm. in the soma, in the soul. So if something comes to me, so I could be sitting with a client and have this sense that there's some history there that we haven't yet addressed. Mm-hmm. And it's almost as if something's floating around in the room. And Terry Marks Tarlow talks about this in her book, Intuition, the neurobiology. I have it right here, so I should probably quote it properly. Well, it was here a minute ago. But anyway, Terry Marks Tarlow, Neurobiology of Intuition. How we embody, based on our brain and our body, ideas, sensations, intuitions, feelings about what's going on in the room and how to tap into that space. I call it the interstitial spaces between the conversation. Mm. And then that becomes a feeling, and I use myself maybe as a question, depending on the relationship with the client. Use myself, and maybe I'll say, well, there's something I'm sensing. And I don't know if we've talked about it, but I'm wondering a little bit about what would you tell me if we went back in time? And I asked you about something when you were 5. And maybe the number 5 pops into my head. Mm-hmm. So that's one way. Now, let's get a little weirder. And let's talk about doing something in a clinical setting that I used to call a psychic reading. Now, this, for your viewers, could be like, never. Mm-hmm. A colleague of mine calls it New Age CBT. whatever that means. She hasn't elaborated fully. So that means that I talk to the clients a little bit using my intuition, and I call it an intuitive consultation. I might say, Paul, I have a sense that somewhere waiting in your future is another book. I happen to know that's true. But, if you were seeing me and I know that you were really diligently writing as you usually are,
Mm-hmm.
that I would say, I feel that energy around you.
Mm-hmm.
And I don't ever pretend to be a fortune teller or a prophet.
Right.
It's more a sense of picking up, there's so many ways to say it, Paul, energy, a vibration, like we talked about in the 60s. I feel the vibes of another book around you. So I feel like that gives you a beginning answer to your question of how to use the self.
Yeah, and as you were talking about that, I was just kind of thinking times where the strange stuff has popped into my mind, and I just say it. And there are times where it falls flat or it doesn't resonate, and that's part of the improvisational
Yep.
nature of therapy. But I have rarely ever, at least me personally, had an experience where when I've said something pops into my mind, and I get the feeling that I need to say it, that the person has been offended or taken aback in a negative way, or they go, well, why are you asking me all these words? I think sometimes we forget that for a lot of people, being in therapy, going to therapy is an odd thing to begin with.
Yeah.
So they don't know much about what we do. So that when we say, something just popped in my head about, the letter K. I don't know. Does that mean anything to you? And they'll go, oh, no. You go, oh, okay. Well, sometimes these things pop into my head and I just say them. And if they work, not. And I've just never really had anyone go, oh my God, what's wrong with you? And I think, and I guess this is a long-winded question coming up here, is that do you think people in our position as therapists, when they have that happen, they're concerned that they're going to lose rapport if they just allow things to emerge?
That is one of the most interesting topics. I could go on, but I'm going to say it to you this way. One of the things we've learned from Scott Miller's research,
Mm-hmm.
and I know you have spoken at length with him, as have I, is that the relationship is the one variable that matters.
Mm-hmm.
What I have found when I use an improvisational something that comes from my vibe, my gut, my head, my intuitive gestalt is what I'm trying to frame it as, people feel elated that you've thought of them.
Mm-hmm.
I've never had anybody say, what's wrong with you? Ever, 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 ever. That could happen, but it hasn't happened yet. In the other realms, other ways, I talk about my friend. This wasn't a client, this was a friend, and I interviewed her. Name in the book is Eliza. And the reason I'm bringing this up is because this is about the spontaneity. Eliza has had many tries going to a therapist. And she's gotten help and she's been good, but she's never been as excited about any kind of helper as she was about going to an energy healer. And what did the energy healer say? Out of whatever intuitive mechanism the healer had in her mind, she said to Eliza when Eliza walked in, something to the effect of, I can see you've been through a lot.
Mm-hmm.
This meant the world to Eliza, and in 2 seconds flat established rapport. How many therapists would say that just looking at the person? Usually is, a little more staid. How can I help you? What problem are you here to solve? Fill out these papers.
Mm-hmm.
And that established a rapport that kept Eliza transfixed through a session in which this person gave her specific suggestions of what to do. And I've written this up in detail in the book. And Eliza followed every suggestion and felt better.
Mm-hmm.
And that was one session. So, brief therapy in a way. Woman wasn't a therapist. So how do we use ourselves spontaneously? I think clients often feel affirmed. If I said to somebody, I think of the letter K, and they could say it doesn't mean anything to me. Often they say, but thank you for telling me, and I'll keep it in mind.
Mm-hmm. Yeah.
And then they might come up with something. The other piece that we aren't talking about a lot, and maybe a conversation for another time, is how to use ourselves spontaneously to help clients draw on their own intuitive knowing.
Mm-hmm.
That's something that's really important to me.
Yeah.
And that is the soul wisdom that I like to talk about in terms of, I'm going to use my inner wisdom, my inner knowing, and how can I help you, my client, to use yours
Mm-hmm.
to solve your problems.
Yeah. When you get a feeling, a therapist gets a feeling, and whether it's an image, a sensation, something pops in their head, how are they able to really differentiate I'm overthinking from my gut, that this is truly my intuition? How have you kind of navigated that in your work?
You've got the right questions. So I've had to navigate that in my work and in my life.
Mm-hmm.
And how I help people and myself to differentiate that is through self-awareness. Because what you're talking about is really important. If, for example, if somebody is going through an acute stress response, like somebody I spoke to recently, there are a lot of intrusive thoughts based on whatever the incident was that caused the extreme stress. And people then have trails of fear, of worry. And so it's important to help the person know what their general business worries are. So if this falls into a category of this is what I do and how I overthink, let's pop it into that category. Let's not assume anything about something precognitive. Now, this is where a lot of people that may get mixed up, that intuition means I can foretell the future. So what I would, and this is not true, precognition could be an intuitive something that comes up, but intuition is not, I can tell the future. So I would put it in the category of, okay, this is a fear or a worry or a maybe, and let's reframe it. And I wouldn't say it to them like this, but I would want to reframe it to see, well, how could we use that impulsive, intrusive something that you're thinking about too much? How could we employ that to help you feel better? Mm-hmm. Also, having worked with kids in a school system for 11 years, I often put these, I'll call it a symptom, but I don't even like the word, an expression of something that they're dealing with, like to think of it as having a function. Mm-hmm. And like, again, utilization, which we've learned studying Milton Erickson, I would find a way to utilize it toward a solution. I might, let's say somebody says, well, I remember years ago, I had this patient many years ago, and she had been driving on the highway, and a dump truck in front of her had a mishap, and a load of gravel and stones came onto her car. She wasn't badly hurt. She was really scared. So then she had a lot of worries about driving on the highway. So how I would use that might be to reframe it. And how could she imagine herself safe? Might she use her intuitive knowing that when she had an intrusive thought of this truck, that instead she could see angels coming off the back of the truck surrounding her. Now that's just coming to me now. I don't remember what I did with her. It was probably at least 2.5 decades ago, but it stayed with me as, a really important event in this person's life. So these are, my takes on some of these things is a lot more detail in the book that addresses some of these issues and questions.
What do you find in your workshops when you're teaching clinicians about these kind of topics? What do you find is the biggest barrier for getting them to really use what is natural? I mean, as humans, we have intuition. That's a natural function. You don't have to be
Totally.
psychic to have intuition.
Right.
But it's like to get them to maybe be more open to have or to use what's already there.
You've got the right questions. So what I say to people is this isn't new.
Mm-hmm.
Intuition's been there forever. But the barrier seems to be that intuitive approaches have not yet been declared evidence-based. And so people are afraid to use something that has not been vetted in that way. That some overseeing psychological organization has not yet said, this works. The evidence that this works is anecdotal, and anecdotal counts.
Mm-hmm.
It just doesn't count in terms of scientific method.
Right.
And I know myself, and I think because of your work and creating a magical session and all the ways that you work creatively, this is powerful. People get better quickly. Mm-hmm. That we often don't even need to take histories that are too lengthy, that's very problem focused. So I could call intuitive approaches rapid cognitive restructuring, and that would be evidence-based, because the mind-body connection works. Mm-hmm. And the intuitive knowing is in the body. Mm-hmm. One of the things that I do in the book, and I don't know that there's time for us today, is I go through a whole section on how do psychics think. Because as you know, my first I was a psychic before I became a therapist. And it's taken me a while to really own that in public. So I'm owning it here as I have in many other places. And psychics have a way of discussing intuitive functioning in somatic ways. For example, everyone's heard the word clairaudience. So people could have a barrier to that, like, oh, it's too woo-woo for me. Clairvoyance, clairaudience. All that means is I can hear it in my mind. I can see it in my mind. So if you're visioning the pizza that you would like to have delivered, and you can taste your favorite toppings, that is called clairgustance, tasting in the mind. That is called imagination. Think about museums that you've been to where they're artisans who created statues from 2,000-3,000 years ago, and we look at them and we go, oh my goodness, where did that inspiration come from? It comes from nature, it came from relationships, it came from whatever the culture was. It came from in here, based on what's here. And we're doing the same thing in our offices. We have what's in here, we have the client out here, and we're putting all of that together in the most creative ways we can. And sometimes that means I'm going to use something that's evidence-based. I like linear models. I like to make them up and insert intuition in them. That's also in the book. Well,
it's with measuring, because that's what science does, is it measures. It's very difficult, and I don't know if we will ever be able to measure intuition, because one never knows, true intuition, when that's going to manifest. And so, you could, I guess, every session a therapist has for a year, but then they also have to tell, well, right then I did this, and then you have to follow and see, if that made any difference. I guess we could do it, but as opposed to trying to measure a technique or a theory, which you start the session I wouldn't recommend it, but a lot of people start the session already in the frame of that theory or technique. And so it was easier to measure. So, and then there's the whole argument too, that that's a form of consciousness. And how can we ever measure consciousness when we're using consciousness to do the measuring?
Right. I love that. Well, I'm not the researcher, so I'm going to leave that to the researchers. What because it would be really hard. So the way I measure myself, I measure each session the way I've been taught by certain colleagues. And here's my measurement. And I say to people, where are you now based on whatever the issue was? Here's where we started. Where are you now? And can you describe to me what happened to bring you wherever they are? Almost invariably, they're better. And then I know to myself, what technique, what approach, I like that word better, did I use? You're bringing up something interesting about, when do those intuitions or those senses, feelings, senses, vision of something, the letter K, the ice cream cone you had yesterday that pops into your head. And this is where I want to cycle back to being in a state of response readiness. So it's also response ready to oneself. And it takes practice to get a sense of you're sorting out at the same time what the client is saying, as well as what you're thinking and what's coming to you. And it's easier to talk about it than to do it in the session. It takes practice. And like you say, not everything you come up with is a big hit, but things give you information. If it's not a big hit, you get information that says go in another direction. There are two types of intuitive knowing. There's receptive, I call it receptive psychic knowing. And that is, I'm sitting in the session with you and you say something and I think, boing, and I try it out. So I've received it, okay? Then there's projective psychic energy, which has something to do with, gets into the realm of healing. But I think of it as putting myself into a state of receptivity to what you give me. So that means I am thinking, taking a breath, settling my nervous system, and affirming for myself that I am available to my own intuitions and the minimal cues that you give me to be able to respond in a way that's going to be useful for you. And that's my goal. Take what you give me, receive the sense in me of where to go next. And it's not always perfect. And what I'm writing about now, finishing up this last piece, is about continuing to switch gears based on what's coming to me to get to the right place for the client. And then continue to affirm for myself that I am projecting my receptivity out to you, and that I'm projecting out that I am available. Again, these are short explanations. Your people that are going to view this may have lots of questions. I'm happy to, answer questions that you can send to me if I can, give a better answer, a more useful answer. But it's a fascinating, fascinating topic. And I do believe that there is a place in the clinical room, a really important place for intuitive knowing, and that it can enhance what we do with the spontaneity, which has to do with picking up and being receptive, and creating, like you say, magical sessions that work, that help people feel better.
Well, Bette, how would people, best way to get in touch with you and find you, folks who might be interested in some of your workshops, your books, and things like that?
I would love people to be in touch if they have questions. Also, as you know, I am doing intuitive consultations. Everything's remote, of course. I happy to give you my email or give you, you have my website, I think,
Yeah.
bettefreedson.com.
Yeah, BetteFreedson.com, and they can also find out all your workshops on there, I think. And
Right now, I'm supposed to be teaching in October. I don't know that that's going to happen. So that part of the website is not up to date. But what I'd love to do is create an online webinar for people who want to develop their intuition, or an online class.
yes,
So I'm happy to, I can give you my email also, which is bjfreedson@gmail.com.
okay. And Freedson
And
spelled Freedson.
EEDSON.
Mhm.
I always say I should change it to Freed Daughter, but it's Freed Son.
Uh, well, listen, Betty, as always, you've given quite a bit of information in a very short time, and I really appreciate you taking the time, not just to talk to me, but to share with everybody kind of some ideas, and hopefully those who are watching may, strengthen their resolve about listening to themselves a little more.
That would be wonderful. And if I can help with that, I would be honored. And it's always such a privilege to work with you. And thank you for inviting me to
Mm.
be one of your bonus guests.
Well, it's been my pleasure. Thank
Bonus for me.
Thank you.
I'll see you soon.
All right.
Bye.